I'm going to talk to you about the floating abdominoplasty, also known as the FAB. This procedure is best used in a woman who's had one or more children, and her main problem is that the muscles are widely spread apart. She doesn't have a lot of extra skin, but has a big bulging tummy. People will often come up to her and say, "Oh, you're pregnant," but she's actually not. Let me show you what I mean. So just for orientation, this is the pubic area, belly button, and here are the ribs. With the floating abdominoplasty, the FAB, one of the benefits is the incision is actually the same length. It's short, and it's the same length as what I use for a mini tummy tuck. And we can put it as low as we want, okay? Usually just above the pubic area, okay? It'll angle up a little bit along the groin, something like that, okay? It's still fairly long, but it doesn't go all the way to the side like a full tummy tuck. But it's literally the same length as a mini tummy tuck. And if you have a cesarean scar, let's say this is the cesarean scar here, always put the incision below that so that we'll get rid of this scar and it'll be a fresh suture. Now what happens is I go down to the muscles and I lift all the skin and the fat off the muscles all the way up to the belly button. When I get to the belly button, this is a representation of that. This is the muscle. I'm lifting the skin and the fat off the muscle. The feet are down here, so I'm coming up in this direction, okay, which is similar to coming up this way. And I'm getting to the belly button. This is the belly button on the outside of the skin, okay, and it has a stalk that goes down to the muscles and attaches to the muscles. So when I get to the stalk of the belly button, what I do is I release it from the muscle right down here at the base and let the belly button come up. That's why it's called a floating abdomen. I let the belly button float up. And then I'll continue lifting the skin and the fat off the muscle all the way up to the ribs. What this allows me to do, it gives me exposure to the muscles all the way up and down the tummy so that I can suture them together from top to bottom, okay? I can stitch the muscles back together all the way down the abdomen. We'll also pull this extra skin down and remove some of the extra. And very similar to a mini tummy tuck, I can usually get out about half the distance between here and the belly button, so something like this. And we'll remove that. This will help tighten the skin. We get rid of the skin fat stretch marks. This edge here is going to get pulled down to there, so that'll help tighten the skin. And then finally, we're going to do some liposuction. And we're going to liposuction on the sides here. These are the glove handles going around the sides. And I'll also liposuction essentially the rest of the abdomen to thin out the rest all the way up and down. Now, when I'm finished, most of the time, as I'm finishing, I will stitch the belly button back down to the muscle exactly where it was. On occasion, however, if I want to, I can actually move the belly button down a couple centimeters and actually, say, put it a couple centimeters lower. Why would I want to do that? First of all, there's some patients who have very high belly buttons, kind of looks a little bit weird. The other time that I'll do this is when an individual has sort of, well, crinkly skin just above the belly button. If you move the belly button down, it'll put this skin under stretch and it'll get rid of some of the crinkliness. So the advantages of this procedure is you've got a short incision. You do not have an incision around the belly button. There is no scar around the belly button. You deal with the entire abdomen, and if necessary, you can move the belly button down a little.